Join us September 21st through the 23rd for the 2023 AMSN Annual Convention in fabulous Las Vegas, Nevada.
Double down on your commitment to our practice and to your patients by gathering with your peers and aspirational leaders for 3 days of learning and networking.
Don't miss the premier event for medical surgical nurses. Register now at amsn.org.
We'll see you in Vegas.
This is Caroline.
This is Maritess.
This is Parker.
And this is Laura. Welcome to Med Surg Moments, the AMSN podcast.
This podcast is an engaging look at the lives of and surrounding medical surgical nurses.
We're proud Med Surg nurses just like you,
sharing our stories, insights, and experiences to support you in your nursing journey.
Our topic today is how to deal with doctors. But as always, before we get started, let's see what's new with everyone. Laura, why don't you start us off?
I am doing great. I am still playing around with my crafts. I think I mentioned on this podcast recently that a friend of mine asked me to do a watercolor for her wedding. And I am my own worst critic. My husband says that every one of them is beautiful, but I've started over 3 or 4 times. So luckily the wedding is not for another month or so. So hopefully between now and then, I'll pick something that I like and stick with it. Maritess, what's going on with you?
When you share that you're yourself is the worst critic, I agree with that. We're too hard with ourselves. I'm sure you did perfectly awesome. So regarding my update, previously I did share that we're going to the Philippines. And so we did. I had my 3-week vacation. It was very nostalgic. That's what I wanted to share. I'm still having some jet lags, I guess. I see myself like awake at 3 a.m, which I am always awake at those times, thinking of what I've done, what I've missed, what I should have done. And I can't wait to go back. Such an amazing time with family. Some of them I didn't get to see. Still very emotional, I would say. So I'm very happy we did it. Parker, why don't you share what's new with you?
Hey guys, hello to our listeners. It's been a while since I've been on the podcast with you guys, and I miss you all so much. So just some life updates with me. I don't know if I told you guys, but earlier this year I was diagnosed with type 2 diabetes mellitus. Super shocking and also daunting as a 29-year-old. Something I just wasn't expecting. Honestly, I think it has a lot to do with mourning. My mom and my grandma, they died 6 months apart. And losing my mom last March. So that's been very difficult for me to deal with. And honestly, I think it's just my body kind of just dealing with all of that mourning. It was a wake-up call. So I've lost 18 pounds since the beginning of the year. I've been working out diligently, doing weight training, eating healthier. This is probably like the best shape I've been in since college, just to be able to take care of myself. What's been new with you, Caroline?
Well, I don't know if I can follow that. Kind of the good news, bad news, I guess, with the diabetes, but it certainly makes you look at your health and wellness. And I know that you're feeling a ton better because of that. So that's incredible. My big news this time around, I took a leap of faith and stepped away from my position as a supervisor in a local hospital. Needed to step away, take some time, do some reevaluating, just kind of get my head around a few things, and then was afforded a most fabulous opportunity. A mutual colleague gave me a call and shared this exciting opportunity. So I now work for a staffing company, and I am the director of clinical professional practice and education. I knew I had to get back into professional development, easier said than done. So I was so delighted to even be considered for this position and interview. And I started about 6 weeks ago now. So why don't we move on to our topic? Today's topic is one that Neil actually suggested. We missed Neil this episode. How to deal with doctors. Although Neil is not here, I can always come up with a story or background about this one. And of course, in the profession that we work, we have to deal with our physicians all the time. We would like to think that it's a collaborative relationship, but over the years, we can all chuckle to ourselves about the good, the bad, and the ugly. How do we deal with them? I think that we have to remember, certainly from my perspective, because I've been around for so long, a lot of the doctors that I've worked with most recently are not many years out of medical school. They are just as lost as some of our nurses are. And I think that right there, that kind of sets a level playing field and fosters that mutual respect. And I've actually got up to some doctors and said, here's a piece of advice, how to get along and influence people and do the best that you can for our patients. Listen to your nurse. You cannot do it without us. We cannot do it without you. Listen to your nurse, especially if they've been around for a little while, and learn from each other. There has to be that mutual respect for all the years and the hundreds of thousands of dollars they've invested in medical school. But there's a lot that they can learn from a seasoned nurse that's been out there. So what about everyone else? Laura, in your wisdom, your experience, what works best? What stories do you have about dealing with doctors?
I think you definitely hit the nail on the head when you mentioned that buzzword respect. I think it all boils down to respect. There's as much stress on a doctor as there is on a nurse, and I think we both need to recognize that. It's hard to learn sometimes to look at things from a doctor's perspective when you are at the bedside and you've got fires to put out and you've got a patient that needs something and you have a doctor that you have to call and relay some information, and hopefully you're going to get what your patient is requesting, but that's not always the case. And it's easy to get short with a doctor who doesn't respond the way you want them to respond. I think if you slow down and you think about things from that doctor's perspective, you have to paint a picture for them of what your patient is experiencing. You got to take them out of whatever they're dealing with and have them think about your patient. So I think your communication skills are key. You've got to paint the picture for them of what is going on with your patient. If they've already rounded on that patient and they're 3, 4, 5 patients down the way, their focus might not be on what your patient needs. So it is up to us to communicate well, to get down to the nitty gritty and help them to see what our patients really, really need. You know, what's going on with the patient right now.
I think a really good piece of advice, especially for new nurses, is to learn the way the doctors communicate. Each doctor can communicate differently. When you learn their communication patterns and sometimes like their behavioral patterns, like, oh, I know this doctor's cranky at the beginning of the shift, or, oh, I know that this doctor prefers being messaged this kind of way. I think that really helps to just manage some of the expectations you have for the doctors you're dealing with. But also you can relate and communicate to the patient, hey, I've messaged this doctor. It may take them a little bit to get back to me, but we're going to get you what you need. And also, you know, managing the expectations of what the patient has for how quickly things get done. I know at the hospital that I just finished my assignment at, there was only one doctor covering one hospitalist for the whole hospital at night. And this is like a pretty sizable hospital. Mind you, there were other specialties there, like in a house like trauma or surgery. But if your patient is a hospitalist patient, then they're a hospitalist patient. So I learned the communication styles of the hospitalists that were covering at night. And so I knew when the best time was to message them, etc. Of course, if it's a patient emergency, then all that goes out the window. And you tell that hospitalist, you communicate succinctly, this patient is experiencing an acute emergency. I need you at the bedside, that kind of thing. So just being able to have a balance between safe and effective communication is a really good skill to have. Also, because I know for some paging systems, you can only use a certain amount of characters when you're paging the doctor. So learning how to say what you need to say in X amount of words is pretty important too.
I love that, Parker. It's almost like knowing the doctor's love language.
Yeah, definitely. with regards to communication, I wanted to share the 6-second communication rule. I always remember my dad, he used to work overseas and he would always tell me 6 seconds is so important. When you make collect calls, I guess, you're getting billed every 6 seconds. That's what he always would tell me. And I would always remember that whenever I talk to doctors, the first 6 seconds is so important. Why? Because you're catching their attention. What are the things that you can say in those 6 seconds that will make them realize that you're not just reporting out, you're not just saying an information. This is a valuable information that you need as a physician, and also as a nurse, you're communicating this information because you need something for your patient. I think it's very important for us nurses to follow certain structures as well. I do remember AHRQ team steps, and they have so many tools that they provide. And my favorite is actually the CUS tool, the CUS tool. C for concerned, U for uncomfortable, and S for safety. So you say, I am concerned that this is happening to my patient. I am uncomfortable that this is what's going on. Yeah, similar to that. And my favorite is, this is a safety issue. This is a safety concern. I'm communicating this to you because you need to do something for my patient and we need to collaborate. This is collaborative. There's some input on their end and input on our end as well.
Very, very true. What you said about collaboration. Sometimes when a doctor has a different viewpoint on what the patient needs, it's hard to speak up. But after having been on an oncology floor for a long time, I got really good at advocating for patients that needed pain medication. And this was happening a few years ago when all the opioid crisis was happening and there was a lot of attention being paid to how doctors were prescribing medications. There are cancer patients that are tolerant to a lot of medications, and sometimes the medications they take are higher than your average patient. So I can remember having a patient come back from surgery and just being in so much pain. I knew this patient very well. I knew this pain was different, and I knew they needed something to get them through just this immediate post-op period. And I called the physician, and the physician basically told me, no, they have enough medication ordered. They just need to wait until the next one is due. And I remember getting off that phone call and just being so angry because I knew my patient and I knew that they were not drug seeking. I knew what was going on and I felt like I needed to say something. So I went to my charge nurse and together we called that doctor back. And after quite a lot of badgering, he agreed for a one-time breakthrough dose. And I gave that to my patient. And later on, they relaxed. They were able to get some rest. And I felt so proud of myself for making the attempt to call that doctor back because I knew what was going on and I had to speak up. I had to say something. And it was uncomfortable. It was hard to call that doctor back because they were obviously very upset with me having called them a second time. But sometimes you just have to do that. You have to take a stab for your patient.
Absolutely. Everyone's making some really valid points. Maritess, you gave me a second to look into a little bit about what you were talking about, the 6 seconds. So in the world of psychology, if you're hit with a sensory stimulus that poses a threat to your ego, your psychological well-being, or your stature, wait 6 seconds before responding. Some people are very uncomfortable with that pause, but it gives everyone a moment, gives the brain a chance to process the sensory information and respond appropriately. The other thing is if you're given a message, if you give that person 6 seconds to respond, it gives them those seconds to gather their thoughts and give a appropriate response to what your request is. It took me a while to remember that when I was calling a doctor after hours, that on-call doctor could have dozens of patients. And so they're not immediately going to say, oh yes, I know exactly who you're talking about. So coming back to communication, which you've all mentioned today, and being succinct, having all the information together, using perhaps an SBAR example, is really important, especially if you're calling after hours. Some of the best doctors I've worked with, and there haven't been many, It's not their education. It's not what medical school they went to. Work with a doctor who's been through nursing school. Has anyone ever had that opportunity? I've had 2 in my entire career of doctors that started out in nursing school and then decided to continue their education. They have such an interesting perspective because they see exactly where we're coming from. One doctor in particular that comes to mind would say to his fellow doctors, first of all, listen to these nurses. Second of all, don't get so hung up on all the rules and regulations of doctoring. Go with your gut. Go with your intuition. Trust that sometimes before you worry about the science behind everything that you're doing. Very, very fascinating to see.
I love hearing about your positive experiences with communication. I've never had the pleasure of working with a physician that's been through nursing school. I have had successful working relationships with a doctor. So one night I had this patient that came in for a hip fracture. Was advanced age. This was my 3rd night with this patient. She had been persistently tachycardic, usually when we're like turning her or cleaning her because of the pain. So the first night we gave her morphine and fluids and that helped to resolve the tachycardia. But the 3rd night, I noticed that she was getting up there like 140s, 150s, and I paged the doctor. I was like, this isn't looking too good. Can you come to the bedside? Something's up. Like, I just knew something was wrong. So she was in a situation with another patient, but I was persistent about it. And she came to the bedside. We took the patient to get a CTA of her chest, and she had 2 pulmonary embolisms. You know your patients, especially when you're on your 2nd or 3rd night with them, you know that something's different. Luckily, she was hooked up to the monitor. She was on telemetry. So it was pretty easy for me to see that something was wrong. So I'm glad that the doctor listened. She came to the bedside and ordered what the patient needed, and the patient got what she needed. I've been a nurse for 7 years now. I've heard about previous dynamics from like 20, 30 years ago where you had to stand up when the doctor came in the room and all these other things and old school nursing. So I never experienced that, but I have had my share of doctors that were just like really rude. And this doctor in particular was an eye surgeon, one of those unique specialties that you just don't hear about very often. I'd never had a personal run-in with him, but I witnessed some things, and that was just him. People would, I guess, complain, but that was just that doctor, and everyone kind of knew it, kind of thing. But luckily, he wasn't like someone you would ever need to regularly page. Luckily, a lot of those patients were also covered by a hospitalist, so he would just kind of come to the bedside, assess the patient, and go about his day.
I have a very strong, vivid memory of being a brand new nurse and making a mistake with a physician and getting yelled at and feeling inferior and just being so angry with myself. The doctor had every right to be angry with me. I did make an error, and it kind of tainted my view of him for the rest of the time that I had to work with him. So I had to really work hard to overcome that. So before I ever called that position, I made sure that I had my ducks in a row. I checked my patient. I had every piece of information that doctor might ask me, and I never gave him another reason to be angry with me. I hated getting caught off guard when I called a physician and not having the answer to something that he might need. So that was a skill that I had to learn early on, is to make sure that I anticipated what questions were coming my way.
As uncomfortable as that was, Laura, I'm sure you learned, like you said, that valuable lesson. It never happened again. Another physician comes to mind who everyone always complains about because he does this, he does that, he doesn't do this, he doesn't do that. But as long as I've worked with this surgeon, you know that he wants humidified oxygen post-op, not just regular oxygen. It has to be humidified. You know that you do not advance the diet until he comes and sees the patient and writes the order. You know that he expects you to go into the room to witness consent when he goes into the room. So don't complain. It's good that he has such a routine and he's so steadfast in the way he takes care of his patients. You know that when you see this particular doctor, you need to stop what you're doing and go into the room. This is for the patient patient safety and for better outcomes. That's what we're all about. And post-operatively, if you go in that room and that patient doesn't have humidified oxygen, he's going to wipe the floor with you because it's a very drying, unpleasant experience. So again, as awkward as it can be, they know exactly what to expect from him. And that is the gift, because I'd rather have someone like that you know what to expect than a doctor that doesn't share a thing and you don't know what they're going to say or how they're going to react. Consistency equals safety, and safety is what we're all about.
Always be prepared.
Yes, exactly. Always be prepared. Definitely.
I really like that because it gives you a sense of trust, that they trust you, you trust them, and it's a partnership, and it's such a great relationship. And if the patient sees that, it's remarkable. They would say, I'm really being taken care of by the great people.
When you think about the fact that they only see their patients for a few minutes a day, they have to really trust us because we're there for the 11 hours and 59 minutes of the shift. So very important. I think we forget that. Yes.
Absolutely. And I do remember one of the physicians who would always call the primary nurse before going to a patient's room. We do have our interdepartmental rounds where physicians would go with the nurses, but sometimes they would forget. So one of the nicest memories I have when I was still working in the bedside, there was one physician who would always call us primary nurses, who's the primary nurse of this patient, and would go inside the room with us. And what's happening inside the room is that it's not just giving the plan of care for the patient, but it becomes also a learning opportunity. If there is a student nurse or if there is a new nurse in the unit, this physician would share experiences. What are the things that needs to be done? And so I like the fact that some physicians are open to that, making sure that we all understand what's going on with our patient, but also understanding that we're all learning. Caroline, I like what you said about some physicians, they are babies. They're still babies, right? And so they need to really listen to the nurses. Also, on another note, for us nurses, we need to understand that since they are learning, we need to really be understanding as well that they do not have all the answers. We need to provide them with specific information to make sure that we put together the puzzle for our patients.
Yeah, absolutely. As they finish med school and start a residency, it's just exactly the same as our first day out of nursing school. And they're terrified that something will go wrong, and we're terrified that we might facilitate something going wrong. And so open communication, honest communication, looking at each other and saying, you know what? I don't know what to do either. It's perfectly okay to be human and collaborate there rather than a mistake be made. And it's hard sometimes as a newer nurse, I think, to step up and question a doctor because they're the doctor. But if they're just straight out of residency and this is their first job, then they want to learn from the nurse and the team on the floor because that's how they get their knowledge and that's how they move forward as well.
I think that we should start looking at our interactions as learning opportunities, because there are things that the doctor knows that I don't know, and there are things that I know that the doctors don't know.
Exactly.
I really think that doctors have little to no clue about nursing skill, nursing specialty, nursing knowledge. We really do juggle a lot with these patients. We're monitoring their vital signs, monitoring input and output, managing drains, managing wounds, antibiotics. I mean, there's so many things that we know how to do that they don't know how to do. I really think sometimes they're just not aware of our scope of practice. So making them aware of our skill set and that we are knowledgeable and that nursing isn't just some rinky-dink profession. Not only are we helping people emotionally, we're actually managing the full care of up to 5 to 6 patients at a time. We can recognize a patient that is decompensating fairly quickly. You know, you can walk into a room and know when your patient is experiencing some acute distress or some acute medical emergency. I wish more physicians knew how knowledgeable we are.
I feel like we are more vocal now as a profession, and I think we really do strive to work together with doctors so that we can earn that respect. That has to go both ways. A doctor has to earn my respect as much as I have to earn a doctor's respect. I have to show them that I know what I'm doing, and they have to prove to me that their focus is on the patient as well.
Well, believe it or not, we're just about out of time. But before we go, let's quickly summarize what we've learned. First of all, if a doctor is early career stage, show them some grace, offer them some advice on how to be successful working with nurses. Mutual collaboration and open communication is definitely the key. There are certainly things that you know that doctors don't, but don't forget there are things that doctors know that you don't. So be open to learning as much as you can. And it's important to slow down sometimes, put yourself in the doctor's shoes and paint the picture about what is going on with your patient. Get to know each of your doctors, their style, their approach to communication. And when it comes to pages or text messages, learn how to say what you need to say in a limited number of characters. Don't forget the 6-second communication rule. Embrace that rule. The first 6 seconds in your conversation with the doctor is so crucial. Front load the most important patient information. And always keep in mind the reason you work hard to have a successful relationship with the doctor is for your patient's ultimate safe outcome. So thanks for joining us, and we will see you next time.
We look forward to connecting with you on the next episode of Med Surg Moments, the AMSN podcast. In the meantime, we want to hear from you. Send us your questions, topic ideas, and feedback via our official Med Surg Moments email address, amsnpod@amsn.org. That's amsnpod@amsn.org.
I'd also like to remind you to become a member at AMSN or renew your membership at www.amsn.org. You receive lots of cool benefits and perks, such as discounted pricing on the annual convention and continuing education.
We encourage you to help us spread the word and subscribe to the Med Surg Moments podcast via your smartphone podcast app to receive notifications of future episodes. Please be sure to leave us a review and recommend Med Surg Moments wherever you get your podcasts to help us reach even more listeners.
I invite you to join the conversation by sharing your ideas and questions on AMSN's Facebook, Instagram, LinkedIn, or Twitter pages. And don't forget to add hashtag MedSurgMoments to your post. Simply enter AMSN in the search field on any of these social media platforms to connect with us.
The content within the Med Surg Moments podcast represents the views, thoughts, and opinions of the co-hosts and may not necessarily reflect the views, thoughts, and opinions of the Academy of Medical Surgical Nurses. Until next time, I'm Caroline.
Laura.
And this is Maritess. And always remember, Med Surg Moments is a moment in our lives, a moment in our Med Surg careers that makes a huge difference.